Nurse Aide Test Prep Georgia. Question 1. A client who is agitated and wandering should be: Option A, restrained to ensure safety. Option B, redirected calmly to a safe area. Option C, left alone to tire out. Option D, given medication to calm down. The correct answer is option B, redirected calmly to a safe area. Redirection is the safest and most respectful approach. Calmly guide the client to a safe area and engage them in an activity. Restraints require an order and are a last resort. CNAs cannot administer medication. Question 2. Which approach is best for a client with dementia who becomes agitated during personal care? Option A, use a firm tone to assert authority. Option B, provide simple explanations and allow choices when possible. Option C, complete care quickly regardless of the client's response. Option D, skip the care altogether. The correct answer is option B, provide simple explanations and allow choices when possible. Simple explanations and offering choices. Example: would you like to wash your face first or your hands? Reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 3. What factor is not known to affect vital signs? Option A, pain. Option B, age. Option C, hair color. Option D, exercise. The correct answer is option C, hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 4. The nurse aide finds a client's oxygen saturation is 88% on a pulse oximeter. The aide should: Option A, document this as normal. Option B, report it to the nurse immediately. Option C, reposition the sensor and wait. Option D, increase the client's oxygen. The correct answer is option B, report it to the nurse immediately. Normal SpO2 is 95 to 100%. An 88% reading indicates significant hypoxemia requiring immediate intervention. CNAs cannot adjust oxygen, that is a nursing responsibility. While repositioning the sensor might be attempted briefly, reporting to the nurse is the priority. Question 5. To prevent aspiration during feeding, the nurse aide should: Option A, feed the client lying down. Option B, feed the client with their head tilted back. Option C, feed the client in an upright position. Option D, feed the client only pureed food. The correct answer is option C, feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 6. The nurse aide should speak to a client who is hearing impaired by: Option A, speaking very loudly. Option B, speaking slowly and clearly while facing the client. Option C, writing everything down. Option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 7. A client with a pulse of 112 beats per minute is experiencing: Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 8. When using a manual blood pressure cuff, the nurse aide should inflate the cuff. Option A, to 100 mmHg. Option B, to 150 mmHg. Option C, to 180 mmHg. Option D, 30 mmHg above the estimated systolic pressure. The correct answer is option D, 30 mmHg above the estimated systolic pressure. The cuff should be inflated approximately 30 mmHg above the estimated systolic pressure, determined by palpating the radial pulse while inflating. This ensures adequate occlusion. Fixed numbers don't account for individual variations and could be insufficient or excessive. Question 9. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 10. A client is angry and yelling. The nurse aide should: Option A. Yell back at the client. Option B. Leave the room and return later. Option C. Listen to the client's concerns and remain calm. Option D. Call security. The correct answer is option C. Listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 11. When disposing of contaminated linens, the nurse aide should: Option A. Shake them out before placing in the hamper. Option B. Place them in a leak-proof bag without shaking. Option C. Fold them neatly before disposal. Option D. Sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 12. The RACE acronym stands for: Option A. Rescue, Alarm, Contain, Extinguish. Option B. Run, Alert, Call, Evacuate. Option C. Rescue, Assess, Control, Evacuate. Option D. Remove, Alert, Contain, Extinguish. The correct answer is option A. Rescue, Alarm, Contain, Extinguish. RACE is the standard fire response protocol. Rescue clients in immediate danger, alarm, pull the fire alarm/notify, contain the fire, close doors, and extinguish, if safe. Question 13. The nurse aide should report which change in a client's vital signs? Option A. Pulse increasing from 72 to 76. Option B. Blood pressure increasing from 118/76 to 126/82. Option C. Temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D. Respirations decreasing from 16 to 14. The correct answer is option C. Temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 14. A client with dementia is pacing and appears anxious. The nurse aide should: Option A. Restrain the client to prevent falls. Option B. Encourage the client to sit down and rest. Option C. Walk with the client in a safe area. Option D. Leave the client alone. The correct answer is option C. Walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 15. An adult client with a respiratory rate of 8 breaths per minute is experiencing: Option A. Tachypnea. Option B. Bradypnea. Option C. Normal breathing. Option D, hyperventilation. The correct answer is option B, bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 16. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A, roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 17. How should the nurse aide shave a client who takes blood thinners? Option A, with a straight razor. Option B, with an electric razor. Option C, with a safety razor. Option D, the same as any other client. The correct answer is option B, with an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 18. The nurse aide should document care. Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 19. Which task is outside the nurse aide's scope of practice? Option A, applying a gait belt. Option B, recording output. Option C, changing a sterile dressing. Option D, offering a bedpan. The correct answer is option C, changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 20. Which is a violation of HIPAA? Option A, discussing client care with the client's family who is present. Option B, discussing client information in the elevator with another aide. Option C, documenting care in the client's chart. Option D, reporting client information to the nurse. The correct answer is option B, discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 21. When counting respirations, the nurse aide should: Option A, tell the client they are counting breaths. Option B, count while appearing to take the pulse. Option C, count for 10 seconds and multiply by 6. Option D, count for 30 seconds and multiply by 2. The correct answer is option B, count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 22. Which sign indicates a client may need toileting assistance? Option A, restlessness and picking at the sheets. Option B, closed eyes and slow breathing. Option C, smiling and laughing. Option D, sitting quietly in bed. The correct answer is option A, restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly. Question 23. The pulse deficit refers to the difference between: Option A, apical and radial pulses. Option B, systolic and diastolic pressure. Option C, radial and carotid pulses. Option D, brachial and femoral pulses. The correct answer is option A, apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 24. What is the most important action a nurse aide can take to prevent the spread of infection? Option A, wearing gloves at all times. Option B, performing hand hygiene. Option C, wearing a mask. Option D, isolating all clients. The correct answer is option B, performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 25. The chain of infection includes Option A, pathogen, host, transmission route. Option B, air, water, food. Option C, bacteria, viruses, fungi. Option D, skin, blood, mucous membranes. The correct answer is option A, pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission.